I like mesh panties. Oh, you could just eat them. They're so cute. Boom, up, boom, boom, boom box. Anyway. Down there. Instead of stuffing your hospital bag with crap you won't use, watch this video instead. I don't know if you guys have noticed this, but the hospital bag checklist or the curate your perfect hospital bag videos, they are out of control. I see people roll up to labor and delivery with like full-size roller suitcases. I'm not talking a carry-on suitcase. I used a carry-on because I have a bad back. I'm like an old lady, but a full-size carry-on suitcase with like a backpack and a bag and a pillow on top, and then they don't use 90% of the stuff that they stuck in there. So as a labor and delivery nurse, I'm going to tell you the 5 things I see people pack in their hospital bags that get used 100% of the time. And the first thing on that list is a phone charger. Because if you think about it, our phones have become our everything. They are our way to talk and to text, but they are also our camera and our video camera and our boombox. I just aged myself. I don't even know if you guys know what a boombox is. You know, boombox. Anyway. They are our source of music. They are our everything. And so when you are using it through labor and through birth and then through postpartum and breastfeeding and on the way home and taking a picture of the baby in the car seat, all of those wonderful things, it really sucks the life out of your battery, especially if you have a phone like mine whose battery only lasts half a day anyway. So a phone charger. Do not forget a phone charger. Not just the phone charger. Don't forget like the nubby that goes on the end of the phone charger because you can't plug like a USB or a USB-C into the walls. It is a straight up plug-in. So make sure that you have both pieces. And the best pro tip I can give you is make sure it is a long phone cord. I'm talking like 6 foot max, like 10, 12 feet, because here's what something people don't know. The plug-ins are sometimes in the most awkward places in our hospital rooms. I'm not sure who designed it, but they could be like way over there in the wall. And most times they'll be behind the head of the bed. So you'll plug it in and then by the time it goes from the plug up and over to the top to you, you'd be like using your phone like this up here or having to constantly unplug it and then the phone charger will fall behind. It's a disaster. So get yourself a real long phone charger. Then you are guaranteed to be able to charge your phone while using it. And trust me, you will use it. The next thing always used are comfy PJs or like a labor gown because you give birth and you've done this amazing thing and then you want to be comfy, cozy, and you want to be bonding with your baby and you want to feel as comfortable and at home as you can while you are not at home. And so I really find that like a comfy pair of PJs or a labor gown can do that for you. And you just became a mama. Now you want to be like a mamacita. So you want to really look and feel your best. Now a labor gown is great for labor, but I do find a lot of times they will get messy and dirty, especially when you open it up and you do skin to skin and the vernix is all over it. So if you are doing a labor gown, you might want to bring 2 of them, okay? But labor gowns are great because they give you the access for all of the laboring stuff and the skin to skin, but then postpartum, they are super comfy, they are loosey-goosey, and they open right up for things like breastfeeding and skin to skin. So that's a great option. But a lot of people will go for like just the hospital gown when they give birth. It gets all nasty, messy. And then once they have that postpartum shower or they get over to that postpartum unit and they're feeling better, they're going to want to put on those comfy, cozy PJs. So look for something that is sweat wicking. You also want to look for something that buttons down, okay, for a couple of reasons. One is that it just makes it easy to breastfeed and do skin to skin. That's always lovely. The other thing that you have to think about is that you might have an IV in place. So if you have something that buttons down, it might be a little bit easier to access and move cords around than if you're like pulling it up over your head and feeding it through the arm. It can just be a little bit of like a twister disaster. So I always say have it where it buttons down. And then also if you are doing pants, you're not doing a long nightgown, you're doing a pants set, make sure that it is a nice stretchy waistband. The thing people don't realize is when you go home or right after you give birth, you look about 6 months pregnant. So if you bring in some tidy, cute PJ pants, it's going to be really uncomfortable, especially if you had a C-section, because then you have this incision that goes right across your abdomen. So I always say if you're doing a 2-piece set, make sure that those pants are stretchy. And I actually did my hospital PJs. That doubled as my going home outfit because I really didn't want to bring my PJs and a going home outfit for myself. So that's something that you can think about as well. I have given birth 4 times and I have seen lots of hospital bags. My name is Tina. I am a certified perinatal nurse. I am also a certified breastfeeding specialist. If you are new here, I would love it if you stick around for even more videos. And if you are not new here, welcome back to it. Let's get on to the next item. Toothbrush and toothpaste. These get used 100% of the time. Actually, toiletries in general, because that first postpartum shower, it is chef's kiss. And sometimes it just feels good to have the things that you use at home and the smells of the things you use at home, those creature comforts when you have that first postpartum shower or that first freshen up in general. It's pretty awesome. And the spectrum of what people pack for toiletries, it really varies person to person. For myself, it was pretty minimalist. I got a little travel shampoo, a little travel conditioner, I had a face wash, and I had a moisturizer. I do have a bigger skincare regime at home, but I just figured like my skin could handle it for a day or two. So I packed minimally, but I have seen some people bring their whole like 15-step routine. That brings them comfort. That makes them feel good. If you like it, I love it. But that toothbrush, toothpaste, I can't stress it enough. And even if you are still in bed, maybe you had a heavy epidural, you can't get up and walk yet, or maybe you had a C-section, so you can't feel your legs at all, you can still brush your teeth as soon as you want to. I'm always like, do you want to brush your teeth? Because for me, like, I hate the feeling of dirty teeth, like having socks on all of my individual teeth. So I'm always like, I need to brush my teeth immediately. So if that is the case, just have somebody bring you a cup of water and a little blue kidney basin, and then you can brush your teeth in bed, rinse with the water, spit it out into the kidney basin, and suddenly you feel really fresh. Because chances are, if you were pushing your baby out or you were in the operating room and you hadn't eaten or drank anything in a long time, or the air is dry and you're like mouth breathing, your mouth and teeth are gonna feel yucky. So give yourself a little creature comfort, brush those teethies. Next up, postpartum comfort items. And yes, I'm talking about down there, and making that feel really, really comfortable. And some hospitals will provide you with things for postpartum care afterwards. And depending on the hospital is depending on how many things are provided. I will tell you this, I find that Canadian hospitals seem to provide a lot less than American hospitals. And it probably has something to do with the astronomical hospital bills that I see coming out of labor and delivery departments across the States. But Canadian hospitals provide you with some stuff. It is not the best quality stuff. And for me, it was important to really sort of treat my bits really well after I gave birth. So if this is sort of important to you, or there's certain things that you wanted to use, this would be something that you would put in your bag that you would absolutely use. So I'm talking about maybe you don't like pads that are, this thick from the hospital that feel like sandpaper. Maybe you want your own pads. I packed some of my overnight thinner pads because that's what I prefer. Now, I like mesh panties. A lot of places will provide you with mesh panties over a disposable underwear just for budgeting issues. I like them. I found them comfy. I felt like it really pulled things up against my nethers. But if you don't like mesh panties, you'll probably want to pack yourself some disposable underwear or some adult diapers if that's how you're rolling. For me, though, I threw in the nighttime ones that I liked for the pads. Then you can also put in all of the extras that make things feel really, really good. The Tux pads, the foams that have witch hazel in them, the sprays. Don't forget your Dermaplast, that's your numbing spray. Those things likely won't be provided by your hospital. But if your hospital did provide them, let me know, because I think it's amazing when they are providing them. However, if it's something that you want to bring, I can guarantee you that you will be using it, because for those first periods of time, those first 3 days, you're going to be bleeding heavily, and you will still be bleeding heavily even if you have a C-section. And so if you do want to feel a little bit more comfortable down there, make sure to pack them. The last item that always gets used, actually this is going to be a 3-in-1, are your baby items. The things that I see that always get used are a going home outfit, a blanket to either use in the hospital or over baby when you do take them outside to go to the car, and of course a car seat. You need a car seat to take your baby home in. So these 3 little items in this section, they always get used. Now you can also bring other stuff for baby and you can pack that in there, things like diapers and wipes. Again, hospitals will provide this, but depending on your hospital and your location, some of them aren't the best. So for example, at my hospital, we have cloth diapers, and then we have little cloths that are almost like paper towels that you wet with warm water, and that's the wipes that you use. So if you have a certain brand that you align with or a certain diaper that you like to use, and then you like the wipes as opposed to like a cloth with water, those are the things that you're going to want to pack because you know that you want to be specific about them. If you are not caring too much about what you use while you're in the hospital and you only care about what you're going to use when you go home, then no, you don't gotta really pack anything else except for that going home outfit, the blanket, and the car seat. Okay, bonus. Here are things that a lot of people pack in their hospital bag and then they say, yep, I didn't really use that. And this is kind of piggybacking off the last thing we talked about, excessive amounts of baby clothes and baby accessories. Now, I get it. This is your baby, your little doll that you have waited forever to hold in your arms and just dress them up and just oh, you could just eat them. They're so cute. But I'm going to tell you this. In hospital, a lot of the time you are spending with baby is spent skin to skin. So that's their naked body and your naked body. It's super beneficial for you. It's super beneficial for baby. And if you are choosing to breastfeed your baby, it's really, really great for initiating that breastfeeding journey. So a lot of the time, they're not in clothes. They're just in a little diaper. Also, there's quite a few tests that get done for baby in that first 24 hours before you go home. So if you have them dressed in like a onesie and a sleeper or a onesie and a three-piece suit, I don't know what you're dressing your baby in. If you have them all dressed up, every time they need to do an assessment on baby, then you got to undress them and you got to pull the onesie over their head. It's just a big ordeal. So I always say, bring the going home outfit. If you really want to, you're not sure what you want to put them in, bring another going home outfit. That's lovely. But all of the bows and the hats and the socks and the mitts and a lot of people just are like, I don't know why I brought this. Wait till you get home and then play dress up. Heavy snacks. Now, I am a huge fan of snacking in labor. I'm a huge fan of listening to what your body is telling you. And if you are feeling hungry, giving it some of those light snacks to get you through the labor process. But if you're packing like really, really heavy stuff, you're packing like a filet mignon and a garlic mashed potatoes in a little Tupperware bin, you're packing something that is greasy or just that's going to sit in your stomach, chances are you're going to end up puking that up later in labor as things progress. Because like in the fight between the stomach and the uterus, like it always wins. And if there's a ton of stuff in your stomach, chances are it's going to come up and out. So I always say pack some light snacks, absolutely. Things that are crunchy are things that I suggest as well, because it sort of gives your palate something entertaining to taste and feel, because it can get a little bit boring when you're just drinking water. Also, pack tons of different types of clear fluids if you really want to, if you're thinking that you're into it. I brought my own thing of apple juice because I'm a little bit particular. Also, I didn't want to have to be constantly asking for apple juice, so that's what I brought. But yeah, avoid packing really, really heavy snacks, because chances are you're going to go through your whole labor and be like, oh, right, there's that steak that I didn't ever heat up and eat. Housecoat, robe, 3 changes of clothes, 8 pairs of socks, a thong, like, you see where I'm going with this. You basically only need to bring for yourself the minimal amount of clothing that you need to be in for like 48 hours or 3 days at max if you do end up in a C-section. If you pack tons and tons and tons of clothes, chances are you are not going to wear not even a third of them. So like I said before in the video, pack a really comfy 2-piece pajama set, maybe a robe if you wanted to have a little extra layer of clothing. And then if you want a different going home outfit for yourself other than that PJ set, go ahead and pack that as well. But you certainly don't need like a formal prom gown and 18 pairs of shoes to go with it. Car seat base, that should be left in your car already installed, or the entire car seat and base still in the box and the plastic wrap. That should already be installed in your car. Actually, speaking of car seats, you don't actually have to bring that car seat up till you are ready to be discharged home from the hospital. So if you want to save your arms from doing like an extra trip and you want to just bring your bags up, you don't actually have to bring the infant car seat with you when you're getting triaged and checked out and then into the labor process and birthing and then postpartum. You don't need it till you are ready to go home. And lastly, expensive jewelry or large amounts of cash. And this one is self-explanatory. Unfortunately, things go missing from hospitals all of the time. And if you brought in like a family heirloom or something expensive and it went missing, like my heart would be broken. So just leave them at home. Really, there's not a lot of situations where you actually need cash anymore. A lot of things are tap or credit card. So bring a small amount of cash, bring a credit card that can stay on your person, but you really don't need to bring anything valuable in. If you like this one, go ahead and check this video out. These are the things that you need before baby comes home, so look into that one. If you like this one, show it some love, give it a thumbs up, and as always, be happy, stay healthy, have fun.